How are you guys, and welcome to my presentation. Today we are going to talk about the types of hypoxia. What is hypoxia and the significance of understanding? The lack of sufficient oxygen in the blood, tissues, and/or cells to maintain normal physiological functions. Hypoxia is an important topic that many pilots should fully understand. Having the adequate knowledge will help pilots prevent and act accordingly if it ever happens to them or their crew members. So, what are the types of hypoxia? There's actually four types of hypoxia. There's hypoxic hypoxia, hypemic hypoxia, stagnant hypoxia, and histotoxic hypoxia. These four types of hypoxia affect pilots while flying and could be dangerous if they are not identified. So, starting with hypoxic hypoxia. This type of hypoxia is commonly known as altitude hypoxia. As altitude increases, there is less pressure, and oxygen particles spread apart. This causes lungs to not be able to supply oxygen to the blood and the body. Then there's hypemic hypoxia. This type of hypoxia is caused by the reduced ability of the blood to carry oxygen. Even if there is a suitable supply of oxygen to breathe, the blood's capacity to carry oxygen to the cells has been reduced. Then there's stagnant hypoxia. This type of hypoxia occurs at the circulatory level. If the blood flow is compromised for any reason, then sufficient oxygen cannot get to the body tissue. Then lastly, there's histotoxic hypoxia. This type of hypoxia happens within the cell. Intoxicated cells are unable to accept or use oxygen. This usually happens with the use of alcohol and narcotics. In correlation with hypoxia, there's the time of useful consciousness. This is the amount of time an individual is able to perform flying duties efficiently in an environment of inadequate oxygen supply. Starting at 20,000 feet in this chart, you have 30 minutes of useful consciousness. Once you get up to 40,000 feet, you only have 9 to 15 seconds. This is important for every pilot to know in order for them to know how long it's going to take them to lose conscience and not be able to fly the plane. So types of symptoms of hypoxia. There's breathlessness, fatigue, cyanosis, deficiency of performing tasks, impairment of mental tasks, and loss of consciousness. These are all important to know. In conclusion, hypoxia is important to know, and all pilots should have a good understanding of it to prevent catastrophic accidents.